Self-massage. You can use your thumb to massage the affected area. Make sure you massage up and down in a direction parallel to your elbow, rather than up and down the length of your arm. Use enough pressure to feel an effect without creating too much pain. Be sensible. If it feels like you're pressing too hard, then you probably are. You can perform the massage for 1 to 20 minutes and repeat up to 3 times per day. In some cases, you may feel pain even with a light touch. If this is the case, then you should consider an ice massage instead. Ice massage. Combining ice with massage is often reported as the most effective technique used by patients. Begin by preparing the skin with massage cream. People often use aqueous cream, E45, and even natural oils like sunflower and olive oil. But you can use anything you like, as long as you're not allergic to it. This is just to help the ice cube to move around on your skin and stop it from sticking. Now, take an ice cube and hold it in a tissue to prevent it from sticking to your fingers. You may have to start the massage gently so that you don't experience too much pain. But as the ice numbs the area, you can increase the pressure for a deeper massage. You should perform the massage for up to 5 minutes and repeat it up to 5 times per day. Tennis elbow stretch. The most effective stretch for tennis elbow focuses on the wrist. Begin by holding your affected elbow straight. Next, simply use your other hand to stretch back the wrist of your affected arm. It's important to use your common sense here. Only stretch to the point of discomfort. You shouldn't experience any pain. Hold the stretch for 30 seconds, relax, and repeat this 5 times. You can perform this exercise 5 times per day. It is best performed first thing in the morning and last thing at night, before bed. Prayer or Namaste stretch. Start by pressing your palms together with your hands held higher than your elbows. Now, push your hands down until they're level with your elbows. Make sure that you keep your palms flat together at all times. Again, it's important to use your common sense and only stretch to the point of discomfort. Do not push into pain. Hold the stretch for 30 seconds, relax and repeat 5 times. You may perform the exercise 5 times per day. It's best to do first thing in the morning and last thing at night. Golfer's elbow stretch. The most effective stretch for golfer's elbow also focuses on the wrist. Begin with your affected elbow held straight. Now, use your other hand to stretch out the affected wrist. Remember to use your common sense once again, and only stretch to the point of discomfort, not pain. Hold the stretch for 30 seconds, relax and repeat 5 times. You can perform this 5 times per day. Like the previous exercises, it is best to perform it in the morning and at night. Reverse prayer or reverse Namaste stretch. For this stretch, you need to hold the backs of your hands together, with your hands held lower than your elbows. Now raise your hands up until they're level with your elbows. Make sure you keep your hands together as you do this. Remember to use your common sense and only stretch to the point of discomfort, not pain. Hold the stretch for 30 seconds, relax and repeat 5 times. You may perform this 5 times per day. Again, it's best to do it immediately after waking and before going to bed. Resisted exercises. Tennis elbow. Tyler exercise for tennis elbow. For this exercise, you'll need a flexible rubber tennis elbow bar. These can be purchased for under £15 each from many retailers. Make sure you choose a resistance that you can actually perform with. The exercise will only work if you can twist the bar. Start by holding the bar in the hand of your affected arm. Your thumb and the bar should be pointing upwards, with your wrist in full extension. This means that your wrist needs to be in a cocked back position, with your thumb pointing upwards. Now grasp the bar at the opposite end with your other hand. Your thumb should be down, with your wrist in the middle position. Next, twist inwards using your good hand. Curl your wrist to do this. don't move your affected hand from its original extended position. You should keep this hand cocked back, even while you twist with the good hand. This will wind up the bar. Now bring the bar flat in front of you with your elbows out straight. Make sure that you keep the bar twisted. Your bad hand should be in the extended position, while your good hand should be flexed. Finally, slowly unwind the bar using your bad hand. You need to spend about 4 seconds releasing the tension under the control of this hand. Now relax and repeat this 15 times. Aim to perform 3 sets of these repetitions, with a 30-second rest between each set. You should do the exercise daily until your symptoms subside. If your symptoms return, start the exercise again. As you get stronger, you can use a higher resistance bar. Most people report good results within 6 weeks. Reverse Tyler exercise for golfer's elbow. For this exercise, you'll need a flexible rubber golfer's elbow bar. These are the same bars as the tennis elbow one used in the previous exercise. Again, you will want to choose a resistance that you can actually perform with. Remember that the exercise will only work if you can twist the bar. Begin by holding one end of the bar with the hand of your affected arm. Your thumb should be pointing upwards, with the long end of the bar pointing towards your other hand. You will be using an underhand grip. Now bend your bad wrist to full flexion and grasp the bar at the opposite end with your good hand. Use an overhand grip. Your thumb should be at the far end of the bar again, and your palm should be pointing outwards. If you're doing this correctly, then your good elbow will be up near your head and your bad elbow will be down by your side. Now, twist the bar by turning your good hand backwards into extension. In other words, cock the wrist of your good hand to wind up the bar. Don't change your bad hand as you do this. Keep holding it in flexion. Next, bring the bar in front of you with your elbows out straight. Make sure you keep the bar wound up as you do this. Your bad hand should be flexed and your good hand extended. Finally, unwind the bar by slowly releasing the tension from the bad hand. It should take about 4 seconds for you to unwind the bar. Relax and repeat this 15 times. You should perform 3 sets of these repetitions, with a 30-second rest in between each set. Repeat the exercise daily until your symptoms subside. Most people report good results within 6 weeks. If your symptoms return, then start the exercise again. As you get stronger, you can use a higher resistance bar. Grip exercises. Resistance balls for grip. For this exercise, you'll need a resistance ball or egg with a resistance that you can grip without pain. Different colours denote different resistances. You will simply want to squeeze it slowly to the count of 2 seconds, and then release to the count of 4 seconds. You should repeat this for 1 to 5 minutes. The longer you do it, the harder the exercise will be. If you find doing this for 5 minutes easy, then you should move up to the next resistance. The exercise can be performed once per day. Wrist extension. The entry level of this exercise uses only the weight of your hand. The resistance can be progressed using cans or other weights, such as dumbbells or resistance bands. Start by resting your forearm on a supporting surface with your palm facing the floor. Most people use a table or the arm of a chair for this. If using a weight, choose one that you can perform with without pain. Now, lift your hand up in a slow, smooth motion to cock your wrist. Try to spend 2 seconds lifting up. Next, slowly lower your hand back down to the resting position. Aim to spend 4 seconds in the lowering phase. You should repeat this 8 to 15 times. At first, you should do 2 warm-up sets with a light weight or no resistance. If you're only able to lift your hand without resistance, then you can use your other hand to help for the first 2 sets. Next, you should perform 4 working sets. A working set should ideally be 14 repetitions, but anywhere from 8 to 15 will suffice. You can perform the exercise 3 times per day, but avoid doing it first thing in the morning. Radial deviation. Like the wrist extension exercise, the entry level of this exercise uses only the weight of your hand. Again, resistance can be progressed using cans or other weights. such as dumbbells or resistance bands. Begin by resting your forearm on a supporting surface, such as a table or the arm of a chair. This time, your palm should be facing towards your body. Choose a weight that you can perform with without pain. Now, lift your hand up slowly in a hammering motion. Aim to spend about 2 seconds doing this. Next, lower your hand back down to the resting position. This should take about 4 seconds. Repeat this 8 to 15 times. Again, you should do 2 warm-up sets with a light weight or no resistance before moving on to performing 4 working sets. If you're only able to lift your hand without added resistance, then you can use your other hand to help for the 2 warm-up sets. Remember that a working set should ideally be 14 repetitions, but anything from 8 to 15 is fine. Again, you can perform the exercise 3 times per day, but you should avoid doing it first thing in the morning. Other resisted exercises: golfer's elbow, wrist flexion. Like the previous exercises, the entry level of this exercise uses just the weight of your hand, but resistance can be added as you progress. Start by resting your forearm on a supporting surface. Your palm should be facing upwards this time. If you're using a weight, make sure you choose one that you can perform with without pain. Now, lift your hand up in a slow, smooth motion to bend your wrist. Try to spend 2 seconds in the lifting phase. Next, lower your hand back down to the resting position. This should take about 4 seconds. Repeat 8 to 15 times. Again, you should do 2 warm-up sets with a light weight or no resistance at first. Remember that if you're only able to lift your hand without resistance, you can use your other hand to help in the warm-up sets. Next, you should aim to perform 4 working sets of 14 repetitions, but anywhere from 8 to 15 repetitions is okay. You can repeat the exercise 3 times per day, but avoid doing it first thing in the morning. Ulnar deviation. This exercise is similar to the previous 3. Again, the entry level uses only the weight of your hand, but the resistance can be progressed using cans, dumbbells, or resistance bands. This time, you'll need to stand with your arms relaxed and your palms facing your body. Choose a weight that won't cause you any pain as you perform this exercise. Now push your hands backwards in a slow, smooth motion. Imagine you are moving a hammer behind you. Try to spend about 2 seconds lifting your hand up. Now lower your hand back to the resting position. You should spend about 4 seconds in the lowering phase. Repeat this 8 to 15 times. At first, you should do 2 warm-up sets with a light weight or no resistance. If you can only move your hand without resistance, then you can use your other hand to help for the warm-up sets. Next, you should perform 4 working sets. Again, you should aim for 14 repetitions, but anywhere from 8 to 15 will suffice. The exercise can be repeated 3 times per day, but it should be avoided first thing in the morning.